Welcome back. It is 9/11. Back to school means backpacks, and with that can sometimes come big problems. Many kids overstuff their backpack or carry them incorrectly, which can lead to trouble later down the road. And we are joined by Dr. Gregory Lopez with Midwest Orthopaedics at Rush. Good morning to you, Dr. Lopez. Great to see you.
Good morning. Thank you very much for having me.
Okay, you're someone who can relate to children in backpacks because you have a few kids of your own, 5, right?
That's right.
Yeah.
We have 5 kids, so we have all sorts of backpacks, different colors, shapes, and sizes throughout our house.
Okay, so if anybody, besides being somebody who deals with orthopedics, you know what's good and what's bad. So let's talk about how important is it to make sure your children's backpacks fit properly?
Oh, it's super important. I'm a spine surgeon, and I see kids every clinic day who are seeing me because their back is hurting. And it's in part from sports, but also in part because of the way they're going about their day with backpacks. It's much better than it was when I was a child in terms of the way they're fitting. But there are a number of things that are very important for kids to have when they're going to school in terms of backpacks.
Okay, so let's talk about
First,
that. What should
yeah.
parents look for? What are you suggesting?
So starting out with the ergonomic backpack, one that is appropriately fitting. It's not much wider than a child's torso, and especially it doesn't hang below their waist by more than 4 inches. You also want to have a thick, well-padded shoulder strap, and this will help evenly distribute the weights across the child's back without digging into their shoulders. Multiple compartments too to help position the weight effectively in the backpack, and also reflective material. If the child's going to school, especially in Chicago when it's still dark outside, help them more easily be spotted.
Yeah, you know, I remember when my kids were in school, I would buy, and it got to be kind of an expense where I would try to maybe get 2 books, one for school and one for home so that they didn't have to constantly go back and forth. But economically, that does not make sense. How much should a backpack have in it? How much should it actually weigh, depending on the child?
No, it's very dependent on the child. You want it no more than 5% of their weight. I mean, 5 to 10%. I mean, ideally, you also, when they're actually holding it, you want to make sure those shoulder straps are tight against their body, along with the heaviest portions within the backpack being closest to the child's back. One of my favorite sayings is pack light but right. They don't need to bring everything home with them. Being effective in what they bring home. Younger kids, it's not as an issue, but the older kids, they bring home lots of books. And now with the advent of tablets and laptops, making sure that those heavy items are right alongside the back is very important for their posture.
Well, that was going to be my next question. How do you properly pack a backpack?
No, that's a perfect question. I think first off, again, the heaviest portion, which is usually the laptop or a backpack or the heaviest book, going right alongside their back. The further away that heavy item gets away from their back, the more stress and strain the spine takes, making it harder on their posture and long-term problems as they become an adult. Next, you want to put the next size appropriate portion over top of the heaviest one. And ideally, if they have a lunch or a lunch bag they're carrying, as you can see in the video, carrying it in their hand, as opposed to trying to stuff everything into the backpack, which is causing them to lean too far back. Right. We would love for kids to use rolling bags, but we know that's not typically going to be used by a lot of children.
Right, but, we know that.
Yes.
Okay, I want to talk to you about scoliosis because you actually have a quick at-home tip for parents to check for curvature of the spine or scoliosis. Yeah. Tell me about that.
No, definitely. And we see it. People are always worried when they carry one strap over their shoulder that they have scoliosis because they're leaning. The easy test is to have the child, when they have their shirt up, to have them put their hands together, straighten their arms, straighten their legs, and they bend forward. And when the observer, which is the parent looking right behind them, if you see the spine tilting one way or the other, you'll be able to see the rotation. Scoliosis typically has a rotational component, and that's where people will find it. There isn't usually a big curve when something is standing up. It's more when we force it into a bending position.
Interesting. Okay, and how common is this, and why is this important for parents to look out for?
So scoliosis is not that common. It is more common in young females, but in general, it's less than a few percent of the whole population. So it's not common to have a scoliosis. And even then, the small curves are very much more common than the bigger curves. Mm-hmm. I think the most important thing is, as a young child, learning appropriate posture, having their head above their shoulders above their waist, if you have a backpack on one shoulder or too heavy leaning the back, or using a phone all the time with the neck leaning forward, these are all things that work to having long-term implications later on in life.
Well, you are giving some great tips. I may need to come see you. My neck is killing me, by the way. I carry a backpack. That might be one of the areas.
Over.
Well,
anytime. We'd love to see you.
Great to see you again. Thanks so much. I think these are some wonderful tips helping a lot of parents. Dr. Gregory Lopez with Midwest Orthopaedics at Rush. Have a great day.
You too. Thank you very much.
Thank you.